Hi guys, in the next 5 minutes we'll discuss the House classification that was given in 1950, which classified denture patients into different groups based on how these patients react to the thought of becoming edentulous and how they adapt to complete dentures. So you can remember the classification with the help of the mnemonic called as SHIP, which is SHIP. The other letter that you must remember is E. So House classified patients into these 5 types, which is skeptical, hysterical, indifferent, exacting, and philosophical. S stands for skeptical. These are the patients that are very difficult to manage. These patients have had bad results from their previous treatments and they think that their dentist cannot solve their problems. Apart from that, their ridges are very severely resorbed and they generally have poor health. They might also have an underlying psychological disturbance. For example, they might have had a recent death of a close relative, or they might have a failed business, etc. So for these patients, it's very important as a dentist to show some genuine kindness and sympathy towards them. You should give such patients more of your time and effort. These patients can be made excellent patients if handled properly. The second kind, that is your H, is your hysterical patients. So your hysterical patients are basically the patients who are very easily excitable, they are emotionally unstable, they are very apprehensive, okay? They might not be aware that their symptoms may be more related to their systemic health. They will not cooperate with the dentist and they tend to have unfounded complaints and unrealistic expectations from the dentist. For these groups of patients, management is really difficult. Often we require medical consultation and professional help for these patients. As a dentist, you must make your patients aware that many of their problems are primarily systemic and not the result of their dentures. The third category, that is I, is your patients who are indifferent. So your indifferent patients do not care. They just do not care about their treatment. They are mainly the patients who are sent or they are forced by their spouse, friends, relatives, etc. Again, these patients are very difficult to manage. You need to educate this patient and you need to improve his interest in the treatment. However, if this fails, it is best to postpone or refuse treatment until some improvement is observed for this patient. The fourth kind of patients are these exacting patients. They're also called as critical patients. So these patients are very methodical and they're very precise. They like every step of the procedure to be explained to them in detail. And that's how they'll get comfortable with the dentist. Apart from that, sometimes what will happen is that the patient himself will propose treatment alternatives to you. And he will also make very severe demands. As a dentist, you must not give in to their demands and you should treat the patient with extra care and effort. Especially, a lot of patience is required for treating these patients. Therefore, these are the exacting or the critical patients. Moving forward to P. P is philosophical. So these patients are your ideal patients. They have the best mental attitude required for complete denture treatment. They are well motivated and they desire treatment for the maintenance of their health and appearance and accept that complete denture treatment as a normal procedure. They are rational, they are sensible, calm, and composed even in difficult situations. So these are your philosophical patients. They are the ideal patients.